Hi students, next important clinical case from kidney, that is nephrotic syndrome. Okay, the clinical manifestation in your clinical scenario is very important, and also clinching point is puffiness of face. That only indicates nephrotic syndrome for undergraduate first year. Another point for this nephrotic syndrome is oliguria. You know the meaning of polyuria, oliguria. Oliguria means less than 300 ml per day urinary excretion. So, puffiness of face, oliguria, these two clinical manifestations representing nephrotic syndrome. Coming to the biochemical parameters, this is very important. Urea creatine level will be normal in nephrotic syndrome, right? Whereas total protein and albumin will be low. These two, that is total protein and albumin level, should be decreased, whereas serum creatinine and urea level is normal. Another important point is 24 hours protein is always increased in nephrotic syndrome. So for this nephrotic syndrome, you should know thoroughly about AG ratio. What do you mean by AG ratio? AG ratio means nothing but albumin globulin ratio, in which conditions the albumin ratio will be reversed. We have four conditions: nephrotic syndrome, multiple myeloma, cirrhosis of liver, and some chronic infections like conditions. The AG ratio will be reversed. Next one is electrophoretic picture of nephrotic syndrome is also important for your clinical case of nephrotic syndrome. Electrophoretic picture or movement of the protein gene electrophoresis for nephrotic syndrome is very important, right? Next one is diabetic keto acidosis. This is very familiar question, but I want to give some tips. Comatose state. The patient come to the emergency department in comatose state. The glucose level is always high. Important urinary finding is both Benedict's test and Rothera's is positive. Benedict's is a test for reducing sugar, you know very well, glucose, fructose, lactose, maltose, like that. Rothera's is a test for ketone bodies, that is acetone, acetoacetate, and beta hydroxybutyrate. So, patient is having high amount of glucose and they are having positive test for Benedict's and Rothera's. Second one is ketone body is present, normal level is less than 1 in blood, it is always high. And next one is respiratory rate is involved, because the patient is having acidosis, no, respiratory rate is increased. So these are all the clinching points for your diabetes. Sometimes they are giving other parameters, lipids also. Diagnosis is diabetic ketoacidosis.